Look to your left, then look to your right. Do you know what you see? People. People trying their hardest to survive in the world currently. Our wonderful nation is currently facing a pandemic, but the state we are in was better than yesterday. On March 13th, 2020, President Trump declared a national emergency to combat the spread of COVID-19 in the U.S., which led to a range of social distancing interventions across the country, including closures of schools, bars, cinemas, and restaurants, cancellations of large public gatherings, including cultural and sporting events, and discouraging gatherings of more than 50 people. Moreover, an increasing number of businesses and companies have been asked to make their employees work remotely. These social distancing measures are reducing the transmission rate of the virus and in turn reducing the risk of death for the most vulnerable population, which is our population of people older than 45 and up. This means that our current president is making every effort to stop the COVID-19 outbreak from spreading any further. As American citizens, we must try our best to make every effort into helping our communities and local businesses as neighbors, which means staying 6 feet apart and washing hands for 20 seconds, as well as wearing masks in public to prevent the disease from spreading any further to the wonderful citizens of our country. In the past, influenza has struck in our country, yet we still continue to survive and strive for greatness. The coronavirus are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, SARS, and Middle Eastern respiratory syndrome, which is MERS. In 2019, a new coronavirus was identified as the cause of the disease outbreak that originated in China, which means that the illness is airborne. So we, the American citizens, must wear masks around others as to not spread or catch this disease. The Centers for Disease Control and Prevention has added several new symptoms to its existing list of symptoms for COVID-19. The CDC has long said that fever, cough, and shortness of breath are indicators that someone might have the disease caused by the novel coronavirus. It has now added 6 more conditions that may come with the disease: chills, repeated shaking with chills, muscle pains, headaches, sore throat, and the loss of taste or smell. The CDC is always finding out more new things about the COVID-19 virus. So as Americans, we must take it upon ourselves to be safe, as well as wear what we need to as to not spread the disease any further. On January 31st, the Trump administration has declared COVID-19 a public health emergency. After 31 days did the Trump administration declare this a public safety event, a lot of people criticized them for not taking action sooner. But 31 days is actually one of the quickest times to respond to a pandemic in the White House for presidents. During January 31st, the administration has also announced Chinese travel restrictions and suspension entry into the U.S. for foreign nationals who pose a risk of transmitting the COVID-19. China, which has been under heavy criticism for a lack of transparency over the coronavirus outbreak, sharply revised its official death toll Friday in the epicenter of Wuhan, adding more than 1,000 virus-related fatalities. China's official Xinhua news agency reported that the undercount stemmed from several factors, including the deaths of people at home because overwhelmed hospitals had no room for them, mistaken reports by medical staff focused on saving lives, and deaths at a few medical institutions that weren't linked to the epidemic information network. The latest figures raised China's overall death toll to 4,632 from a previously reported 3,342. Chinese officials have denied covering up cases, saying their reports were accurate and timely. However, the UN's World Health Organization has come up under the criticism for defending China's handling of the outbreak. President Trump has suspended funding to World Health Organization over what he alleges is pro-China bias. Thus, as long as we have a president who is working for the people, then we will come back and thrive again. Now, as a scientist, my personal opinion is that we must do our best to stay safe inside our homes and for our families, which means when going outside and meeting public people, you must be wearing a mask at all times, as well as washing your hands whenever you touch something, or maybe wearing gloves outside. Now, COVID-19 is a very spreadable type of disease here, so we must be very careful who we talk to and what we say and how we interact with them.